Accident Prevention and Emergency Treatment, Module 6. In the infant, accident prevention, really important to discuss safety issues with the family caregiver. They need to know car safety, child proofing, prevention of aspiration, falls, burns, poisoning opportunities, and bathing accidents. A person should stay with the infant pretty much all the time. They always need to be supervised, and safety precautions should basically stay one step ahead of the infant. Those people who have had children know that once a child becomes mobile, whether it's crawling or rolling or scooting across the floor, that they can move very quickly and they can get into things very, very fast. We also need to teach older siblings to be watchful for possible dangers that the infant might get into. With aspiration, always hold the bottle, never prop it. Crib and playpen bars should be no more than 2 3/8 inches apart to prevent their head getting stuck. We need to check for items around the infant, looking for anything that's small or loose that they could put in their mouth and potentially choke on. That would include plastic bags, suffocation. We need to be aware that we are not putting pillows in the crib or blankets that they could potentially suffocate themselves with. Uh, Another thought is making sure that there's no way that they can get stuck between cushions of some kind where they could potentially suffocate. We also should avoid giving infants hot dogs, grapes, nuts, candy, and popcorn because of the risk of choking on these things. If you cut the grape up in small pieces or if you cut the hot dog up in small pieces, that might be okay, but be aware that these are the most commonly choked on items. Make sure that we remove bibs at nap and bedtime, so once again, uh, they aren't choked, and we never tie the pacifier around the baby's neck. Never leave an infant unattended, especially on a high surface, because they can quickly roll off onto the floor. Make sure that you place gates not only at the bottom of the stairs, but at the top of the stairs, making sure that the infant does not fall down the stairway. And crib rails. Raise and lock those crib rails. They're little Houdinis once they learn to start motivating. Once they're able to start standing, then they can easily crawl over those bed rails. So then you have to lower the mattress in the crib. As far as motor vehicle accidents, making certain that you're using an approved car seat in the back seat. And the rule of thumb is if the car seat has been in an accident, it should never be used again. Never leave a child unattended in the car. Never leave an infant alone in or near water, not even for a second. Making sure that we always fence swimming pools and have gates that lock. As far as burns and injuries, making sure that we cover any unused plugs and keep cords out of sight. Children, especially infants, are very, very curious. They don't necessarily understand that this cord could be dangerous. They're teething, they chew on everything. They could easily cause an electrical burn. Removing tables or tablecloths or dresser scarves, anything that the child might grab and pull as they're pulling themselves into a standing or sitting position. Making sure that you pad sharp corners And turn the hot water heater temperature down to prevent unintentional burns from hot water. As far as poisoning, making sure that you examine toys for potentially toxic materials, and any toxic materials you have, make sure that you lock them up. One rule of thumb that I like to teach new parents is assume that most houseplants are poisonous because a large number of them are, and making certain that they're not within an infant's reach or toddler's reach. Monitor for any lead paint or lead dust that might be in or around the house and prevent any infant contact or inhalation. And of course, lock all medications in the cabinet. Some of these preventative measures might seem a little ridiculous for an infant, but once a child learns how to start moving around on their own, again, they can be very, very difficult to keep an eye on 100% of the time. So taking the precautionary measures and being one step ahead of them is very important. As for toddlers, accidents are the leading cause of death in toddlers. They also require constant supervision. They can get into things so quickly. With motor vehicle accidents, many of their deaths can be prevented by using restraints appropriately. They still need to be in car seats and they need to be appropriately strapped in. Making certain that we're teaching road safety, such as crossing the street at corners, recognizing traffic lights and what they mean, not walking between parked cars, etc. As far as drownings, this happens most often in the bathtub, wading pools, and swimming pools. Never leave a child unsupervised around water, even for a moment. That's all it takes. Make sure for burns that you're managing electrical cords and outlets appropriately. Again, toddlers are very curious, and sticking things in outlets is a very, very common uh, thing that toddlers can do. Make sure that you turn the handles of the pans toward the back of the stove so a toddler doesn't reach up and grab a pan handle that contains hot items, and keeping hot liquids out of a child's reach. Again, consider turning the hot water heater temperature down to avoid unintentional burns, and never leave a toddler unattended. To prevent poisoning, lock all those harmful substances and medications away. Use those safety latches on drawers and doors. They will learn quickly how to open them, but at the same time, it will prevent one more barrier, one more chance for you to catch up to them, so to speak. Never leave harmful substances within a child's reach. Be very conscientious of what is laying around and what they could stick in their mouth. That's one way they learn, and one way they explore is by putting things in their mouth. Make sure you have that poison helpline number programmed into your phone, or having that number very close by at all times. The most common medications that are involved in poisoning include acetaminophen, salicylates, laxatives, sedatives, tranquilizers, analgesics, antihistamines, heart medications, cold and cough medications, and birth control pills. One thing we need to consider is medication for children is made more palatable by flavoring it, so it might look like candy or might taste like candy. But we need to make sure that children know that this is not candy and they should never take it without being given being given to them by an adult. As for preschoolers, caregivers have to be good examples. They require constant supervision in a controlled environment. Again, very important and vital. Accidents are a leading cause of death of children between ages 1 and 4. Common causes include those motor vehicle accidents, drownings, burns, poisonings, and falls. These children are learning to ride bikes and scooters and skateboards, and they should be taught to always wear the helmet. Many motor vehicle accidents are preventable if restraints are applied appropriately. And again, preschoolers are still required to be in car seats, so federally approved child safety seats should be used appropriately. Accidents also result when a child is playing in the driveway and they're not seen by the adult driving the vehicle. Preventing motor vehicle accidents: never start a vehicle until the child is secured appropriately in their car seat. Pull over if the child manages to get out of the car seat. Never permit a child to stand in a car that's in motion. Remind a toddler to wait at a corner until the adult is there to escort them across the street, and reminding them to cross only at corners. We need to make sure that they're aware of the traffic signals and what those signals mean. Never let a child run into the street after a toy or a ball, and remind them to never walk between parked cars. One rule of thumb that I always practiced with my kids and my grandkids is if they're not tall enough to see into the windows, they need to be holding someone's hand. As a driver, always be on the alert for children that are running into the street when you're in a residential area or potentially running in a parking lot. Again, swimming pools should always be fenced on all sides with a secure gate, one that locks. Never leave a toddler unsupervised with a pool, or this includes even those small plastic pools, and never leave them unsupervised if you live around a body of water. All it takes is just a small bucket of water for a child to drown. And believe me, this is there because it has happened. Burns, they are most often from scalding or from immersion into a tub of water where the water is too hot, spills, or from exposure to uninsulated electrical wires or live extension cord plugs. Playing with matches. Burns can have long-term or permanent effects, so we need to prevent them. So never let electrical cords dangle over the counter or a table, making sure that you repair frayed cords. Use safety caps on those electrical outlets, turning those handles of pans on the stove toward the back. Place cups of hot liquid out of the preschooler's reach. Don't use those tablecloths or dresser scarves that hang over the edge. If you do, then make sure that know that toddlers and preschoolers can use them to pull themselves up off of the floor. Make sure that you use caution when you're heating foods in the microwave because they can develop severe hot spots. Supervise these kids all the time when they're in the bathtub and make sure that they're not turning the hot water on. Make sure that the home water heater thermostat is set at a lower setting. Keeping matches and lighters out of their reach and stored appropriately, and never leaving small children unattended. These kids are also good at ingesting those toxic substances. They can still sample just about anything. If it comes in a package that looks attractive, it's very, very tempting for them to put it in their mouths. Poisoning is the most common medical emergency. They do have the Mr. Yuck stickers. They can be helpful, but they're not necessarily sufficient in preventing poisonings. So keeping all toxic items under lock and key or totally out of the child's reach. They can be very resourceful in getting uh, into areas they don't belong or opening containers that are supposedly childproof. Again, common medications that would cause poisoning would be acetaminophen, salicylates, laxatives, sedatives, tranquilizers, analgesics, antihistamines, heart meds, cough and cold medications, and birth control pills. So we have to keep those harmful products and household cleaning products locked up, out of their sight, and out of their reach. Continue to use those safety latches and locks on the drawers or cabinets. Make sure that you're reading the labels very carefully prior to using any product so that you're not inadvertently causing poisoning situations. Replace child-resistant closures and safety caps immediately. Never leave alcohol or e-cigarettes or nicotine refill cartridges, gum patches, gum or patches within a child's reach. Keep products in their original container. Never put non-food products in food or drink containers. Remind kids not to eat or drink anything unless it's been given to them by someone they trust, an adult. Don't take medication in front of toddlers. Don't refer to medicine as candy, and check your home for old medications. If you have some, dispose of them appropriately. Be aware that infants, toddlers, preschoolers, those button batteries, those are very appealing. They're small and they can fit in the mouth very easily. So making sure that you're keeping those button battery compartments on household products taped, secured, appropriately store the batteries. Again, plants, most household plants do have poison in them if they're ingested, so keeping them out of children's reach. Keeping lotion, cream, powder, cosmetics, insect repellent out of their reach. Keeping those poison line phone numbers nearby or programming them into your phone. Highly recommended. Then we get to the school age. Accidents are leading causes of death during this period. These kids have to learn the rules of safety and they have to be encouraged to practice them. They need to know about traffic lights and how they work. They should know their full name, their caregiver's name, their address, and their phone number. They also need to know the appropriate way to call for emergency help. And we don't have to wait until they're school aged. We can teach them as preschoolers how to call for help. Uh, Making sure that you have a safe home program. For example, teaching a child if they feel like they're in an unsafe situation, which homes might be safe and they can just go into those homes without knocking on the door as if they live there. Making sure that you have programs in your home that promote safety. We have a lot of these latchkey kids, the kids that are home on their own. Well, what do they do in case of a fire? What do they do in case a storm comes? Or what do they do if a stranger knocks on the door, etc., etc., etc. So having different programs in place. Maybe encourage school-aged children to meet with police officers to learn that, you know, they're there to help you. Try taking a look at tips for reinforcing family teaching, those safety topics for the elementary school-aged children. As for adolescents, we have an increasing number of adolescents that die from violence, motor vehicle accidents, homicide, suicide, and other causes. The leading cause of death for 15 to 19-year-olds are unintentional injuries and homicide. This population does uh, participate in risky behaviors. Deaths are unintentional, such as motor vehicles or fires. They can be intentional, uh, stemming from violence or suicide. They suffer injuries if they engage in alcohol or drug use. They can die from those, or they can suffer life-altering injuries. Sexual behaviors, pregnancy in these adolescent kids is not uncommon. Uh, the STIs, which can lead to further potential issues such as sterility or lifelong issues. Tobacco use and dietary behaviors. Talking about some of your mental dietary behaviors such as bulimia or anorexia nervosa, where they binge eat, but because they feel that they are um, unattractive, they weigh too much, then they cause themselves to vomit everything up, which can cause significant internal injuries in addition to being malnourished. And then with anorexia nervosa, they see themselves as being fat. They don't understand that they are actually too thin and can start taking medications such as diuretics or laxatives. You can get a medication over the counter called Epicac that actually induces vomiting. So, any of these medications can be abused and cause significant risky dietary behaviors. Any of these issues can result not only in physical uh, trauma, but also psychological injury from being the victim of one of these things. Violence is on the rise in schools. We see domestic violence and child abuse. There are peer support groups available, such as Students Against Destructive Decisions, and there's a lot of programs in the schools that might be beneficial. These kids need to be taught how to work through issues in nonviolent ways, and we need to promote safety issues and provide that positive role model. As far as poisoning, again, infants and toddlers explore their environment by tasting things. Ordinary household has an abundance of poisonous substances, a lot of things that we don't even think about. We need to keep those harmful products and household cleaning products out of the way. I've already been through all of this in some of the previous informations. We do need to seek help if the child swallows a substance that is not food and call the Poison Control Center. If the item is caustic, in other words, it can cause damage going down, that means it can also cause damage coming back up. So there's several things that we would not induce vomiting for. There are some things, however, that we would induce vomiting. But by calling the Poison Control Center, they have a list of all of these uh, different chemicals and things uh, that can cause harm. So they can give you appropriate direction as to what to do. One thing that might be given if they're taken to the hospital is activated charcoal, because that can actually um, help with the caustic substances. It can help deactivate them. There are special antidotes that are available for some poisons. Treatment steps in order of importance means, first of all, you have to get rid of any additional poison that might be there. Excuse me. If the child has ingested, let's say, a household cleaner, get it moved and out of the way. Call 911 if the child has collapsed or they're not breathing. Otherwise, call the Poison Control Center first. Then you would call 911 if the Poison Control Center directs you to do that. And then we will give general supportive and symptomatic care. Check out the table 38.2 in your textbook for some additional information. But once again, if the child is collapsed or not breathing, immediately call 911. But if they're still alert, call poison control first and then follow their direction. Excuse me. Having worked as an ER nurse, I can pretty much guarantee that the first thing that ER is going to do, the emergency department, is they will call poison control. Lead poisoning is a pretty significant issue. Uh, Lead is found in a lot of our old paints. It's found in a lot of the old pipes. It's found in solder. Uh, it is more prevalent than what we think, and poisoning can occur through ingestion or inhalation. Again, we know that infants and toddlers have a tendency to put any object into their mouth. They can also develop what we call pica, which is ingestion of non-food substances. Exposure to lead during pregnancy can also affect the infant. Screening for lead poisoning should be part of a well child checkup between ages 6 months and 6 years, because again, lead is pretty prevalent and you may not even realize that a child has been exposed. So we're trying to screen for this to try and determine if they have been exposed unknowingly. Sources of chronic lead poisoning, again, can be that lead-containing paint, and we find this in some of the older homes. It can be inside the house or outside the house. Furniture and toys that have been painted with lead-containing paint. Vinyl mini blinds. Drinking water that's been contaminated by lead pipes or copper pipes with those lead soldered joints. Dust that contains lead from lead paint or lead smelters. Storing fruit juices or other food in improperly glazed earthenware. Inhaling fumes from engines that contain lead or from burning batteries. Exposure to industrial areas with smelteries or chemical plants, or hobby materials that contain lead, such as stained glass, solder, fishing sinkers, and bullets. Clinical manifestations. It has a very subtle onset or insidious onset. Early indications would be irritability, hyperactivity, aggression, impulsiveness, disinterested in playing, a short attention span, lethargy, learning difficulties, easily distracted. And this can progress to encephalopathy, convulsions, intellectual disabilities, blindness, paralysis, coma, and death. We diagnose it by examining the environmental history, Where did they live? What type of atmosphere? What type of toys, furniture, blah, blah, blah. Lead level poison or lead level blood screening would also be done to determine if lead is available or present in the body. Then we use the chelating agents to remove the lead. These are basically agents that metal will bind to. Nursing care, monitor urine carefully, blood cell counts, renal function tests, hydrate them well, and educate the family. Prognosis is uncertain, but early detection, of course, is always going to be best when it comes to determining how well they'll get over something. We need to remove the child from the lead-containing atmosphere or environment, and that will provide the best hope. Follow-up would include routine examinations to prevent recurrence and observing for any residual brain damage. So basically, we need to prevent lead poisoning. If a family lives in an older home, make sure there is no access to old lead-based paint. Using a wet mop versus vacuuming on hard-surfaced floors will help pick up any lead dust. Washing the hands and face before eating, washing toys and pacifiers frequently, preventing a child from playing in dust near an old house or a major highway, fully flushing faucets prior to using for cooking or drinking or making formula, avoiding contaminants from hobbies or work, making sure that the child eats regular meals and encouraging them to eat foods that are high in iron and calcium. So again, ingestion of foreign objects. Kids are going to put small objects in their mouth and swallow them quite often. Normally, they will pass through the GI tract quite easily and be expelled in the feces, and we would watch the feces for 3 to 4 days if no choking or gagging or pain occurs after swallowing the object. Some objects can get lodged in the esophagus and require extraction. Common items: hot dogs, peanuts, carrots, popcorn kernels, apple pieces, grapes, round candy, batteries, an open safety pin, coins, buttons, magnets, and marbles. We diagnose this with the history. What were they playing with? What was laying around? Fluoroscopy or x-rays. Treatment will depend on the object and the symptoms. If they're coughing, we always encourage the child to continue coughing if the coughs are forceful enough. If they're choking, we have to begin those rescue efforts. With the infants, the back blows and chest thrusts. With the children, the Heimlich maneuver, progressing to CPR if necessary. If there's not any respiratory problems, they're coughing but not expelling the object, they may require transport to the emergency department for possible removal of that object. If the object is aspirated into the larynx or the bronchial tree, they will require emergent care and removal of the object. Question: true or false? Anytime a toddler swallows a foreign object, it should be considered a medical emergency and appropriate care should be given. This is false. Again, it's not always an emergent situation. Most burn accidents are going to occur in children that are younger than 5 years of age, and most of them are preventable. This includes thermal from hot objects or fire, electrical or chemical burns. We start off by removing the heat source and stop the burning. If it's electrical, make sure that we remove or that we turn the electricity off. Provide emergent care as needed. We can apply cool water application if the area is not too large, but never use ice water or ice packs. If the area is large, it can actually cause hypothermia. Make sure that they have adequate ventilation, that they're able to breathe, their airway is open, they have good circulation. If they're a victim of a fire, make sure that you're observing for signs of smoke inhalation and burns of the respiratory passage area. Remove clothing to assess the entire body. If they are transported to a special burn unit, we will typically wrap them in a sterile sheet. With superficial burns, it requires that the area is cleansed and application of an antimicrobial ointment or cream, and apply a sterile dressing, analgesics for pain. If there's blisters, do not break them, but if the blisters have already broken, then we can debride them. Follow up in a couple of days to assess for infection. With a partial thickness burn, they may require biosynthetic dressings that will remain in place for several days without needing changed. Full thickness burns require intense management, and this management will be provided at a hospital or a burn unit. It's dependent on the percent of the body surface that is involved. Location of the burn, the depth of the burn, the cause of the injury. We do need to suspect potential child abuse in some instances, especially if there's a presence of additional injuries or chronic injuries, I guess. Also, be aware if they have chronic disease or disorder that there might be, number one, child abuse, or there might be additional things that we have to watch for as far as complications. Provide appropriate nutritional support. They need 2 to 3 times of the caloric and nutritional requirements to heal burns. Urine output and diureses. Renal shutdown is a serious threat, so we have to monitor I's and O's. They may also require an indwelling catheter. Hypervolemia can occur within 24 to 96 hours after the injury, and this would require slowing or stopping of the IV fluids, notification of the healthcare provider if there is a rapid rise in urine output, tachypnea followed by dyspnea, an increase in the pulse pressure, mean blood pressure, or an elevated central venous pressure or CVP. We have to protect these kids against infection. Antibiotics might not be effective. Make sure that we're checking their immunization status. Tetanus is an immunization that may be required with a burn. Use sterile equipment and aseptic techniques. Depending on the extent of the burn, may require the healthcare providers to wear PPE, including the gown, mask, head cover, gloves, and that would also include visitors. If they're not in a specific burn unit, we have to use a room with a door that can be closed. Wound care, we can leave it open versus closed. The open method is most commonly used for superficial burns, burns of the face and the perineum. We apply antimicrobial ointment topically, which does require a strict aseptic technique. With the closed wounds, make sure that you use non-adherent materials to cover the burn. Dressing changes can be painful, so they might require analgesics prior. And infection can occur under the dressing. Daily debridement and hydrotherapy may be performed. Diversionary activities would be helpful, so distract them. Encourage the child to be a participant in their care. Again, topical medications might be used depending on the type of burn and the organism that is found in cultures of the burn area. And treatment may also require grafting. Complications of burns include contractures, which would be scarring that leads to deformity and limited movement. May require splinting, exercise, pressure garments to help decrease hypertrophy of scar tissue. And they may have to be worn for an extended period of time, a year, year and a half. May also require some long-term care where they go into rehab, requiring additional treatment or plastic surgery to release contractures or therapy. One thing that we need to be aware of is the rule of nines that we use in the adult may not be appropriate for kids for the simple fact that they have a different body proportion. So using the rule of nines may not provide us the appropriate burn extent. This is going to require the Lund and Browder method. True or false? One of the main concerns when treating a child with a serious burn is stopping the pain. Excuse me. This is false. Head trauma. This is a broad term used to describe head injuries that can include any kind of distress to the scalp, the skull, or the brain. And this includes fractures, concussions, bleeding, bruises. We look at the traumatic brain injury or the TBI. These are serious injuries that affect the brain. They can be mild, moderate, or severe, and they are significant causes of serious injury or death in children. We use the Glasgow Coma Scale to help diagnose or classify the severity of the head injury. Primary causes of head trauma in children include falls, child abuse, bicycling, inline skating, skiing, motor vehicle accidents, and sports. The amount of bleeding, if there is a laceration on the head, can be alarming because there's so many blood vessels in the scalp. Apply ice packs or pressure to help stop that bleeding. Observe the child for at least 6 hours after injury for vomiting and change in level of consciousness. If they fall asleep, just wake them up every hour to 2 hours and check on their level of consciousness. Be sure that you do not give them analgesics or sedatives, though, because you want to be able to wake them up. And check their pupils every 4 hours for a couple of days. Notify the healthcare provider if the child begins vomiting. You see pupillary changes, their vision becomes double or blurred, they have a change in the level of consciousness, they begin acting strange or confused, they have trouble walking, they have a headache that's more severe or wakes them up from sleep. We expect them to have a mild headache with a head injury, but if it's severe, that definitely requires follow-up. Complications include hemorrhage, hypoxia, cerebral edema, and increased intracranial pressure. Abusive head trauma can also include retinal hemorrhage, intracranial hemorrhage, and the shaken baby syndrome. Drowning is the second leading cause of accidental death. And toddlers and older adolescents have the highest rate. Infants are going to more commonly drown in bathtubs, while toddlers and preschoolers will more commonly drown in pools or small bodies of water. Older children, it's usually due to unsafe play or unsafe actions. A responsible adult should continually supervise kids. Treatment: immediate CPR and continue it until the child is transported to the medical facility. For further information, check out Table 35.3 and 35.12 in your textbook. Another question: which age group is most likely to receive a head injury from child abuse? This is going to be the toddler. And now time for your post-test.